Good afternoon, everybody. Welcome to the September 29th, 2020 meeting of the Council Budget and Effectiveness Committee. We will start out with introductions, as we usually do, commencing to my left.
Mayor Pro Tem Julie Eisel, committee member.
Kelly Flannery, Chief Financial Officer.
Ryan Bergman, Budget Director.
Ed Dreeks, Committee Chair.
Donata Jackson, Office of Constituent Services.
So we have two items on our agenda today, a police budget review. Oh, actually, let's get the online introduction. Sorry. Who is with us online? I see you, Renee.
Renee Johnson, District 4.
Malcolm Graham, District 2.
All right. You said Jamira is not on yet? Okay. Two agenda items today. The police budget review, which we want to finalize for referral to the manager for incorporation in our report on CMPD. And the second item, in fact, is the considerations about what those recommendations are. Before we start with the staff, I just wanted for the committee to kind of high-level recap what we've discussed so far. Initially, we got a report from Mr. Bergman that showed the kind of buckets within the CMPD budget. And he explained to us that roughly 80%, I believe, of the budget is basically personnel expense. And the remainder of the budget can be broken down into a portion which is funded from federal and other sources over which we don't actually have any discretion, and then a discretionary portion of $20-some million for purchases and non-personnel components. We looked a little bit at that. We studied what the elements were in that, and we received in some detail a 40-page breakdown of what those purchases are in a number of key expense categories for the scrutiny of the committee. We subsequently had explained to us how the manpower levels, the needs of the CMPD are defined, and essentially starting from the calls for service, they back into a number of officers that are required to respond to the calls of service, and they infer from that the total numbers of officers that you need to have on staff in order to have available the number of officers to respond to calls for service within certain time parameters, established time parameters. So that kind of defined the size of the department, and we had some discussion about what those levels were. According to that analysis, the total, the indicated staff complement was actually higher than our actual and higher than our budgeted number. So if you took the actual number of officers we had, that was 190 officers fewer than the budget, and 500 officers fewer than might have been indicated by the analysis of the calls. We did talk about the fact that the 190 officer vacancy or shortfall was offset in part by overtime payments, so that you don't actually have an unspoken for budget position of 190 officers. Instead, what we do is we pay the officers we have overtime. And I think that was a kind of broad recap of how we got to where we are today. So now I think what I'll do is turn it over initially to you, Mr. Bergman. Thank you.
Good afternoon. Councilman Driggs recapped for us, so I'll just say a couple of things. From the last meeting, there was very specific requests around the call data, and then what are some of the areas that officers are doing that may be able to be done with someone else? There was some uncertainty at the meeting whether or not we could turn around prior to that October 5th meeting. We really appreciate CMPD prioritizing this effort. I know that Kelly and I were exchanging a bunch of emails over the weekend, so I know she put in a lot of work on this, which we appreciate given our time frame. So what CMPD is going to talk about today are the priority 5, which are the lower risk calls. They put it into buckets where it adds up to about 67,000 man hours. So they'll talk a little bit about which of those and how they could be done with other types of employees other than first responders. I do want to make sure that we're all on the same page and just level set that we're working very fast on this along with you guys. We're working with Safe Communities, following along. So this is certainly not a fully developed proposal. So what we wouldn't be looking for today is 100% sign off. It's really the concept that they're exploring. CMPD will talk a little bit about how it might work, and we hope to have enough to have a full discussion and a recommendation for next week. But these are certainly changes, and so it would take a little bit of time, and we would ask for your patience in that regard as we actually would fully develop the program. So with that, I will turn it over to Deputy Chief Voorhees, who can introduce his staff there and then get us started.
Mr. Bergman, I just wanted to acknowledge that Councilmember Ajmera is now on the call with us as well. So welcome, Dimple. Chief Voorhees.
Yes, sir. Okay, thank you very much. I'm Deputy Chief Kurt Voorhees from Patrol Services at CMPD, and I have Kelly Highfoster with me in the room, our business manager, and we have our data analytics manager, Monica Wynn, and I also have Captain Ryan Jackson, who is our community service captain over community policing crisis response team. So he's here for any questions we may have. Mr. Bergman, I appreciate the disclaimer that you gave about this being, just some really high-level ideas that we've had. We certainly scour the policing world for ideas, and we consider the best ideas, hopefully, to see if there's anything that we can do to improve here at CMPD. So we're going to try to put our slideshow up here, our PowerPoint, and if we can get that, you let me know that you can see it. Can we do that?
She has to do it.
Okay.
It's loading now.
Okay, thank you. I'll go ahead and just start. The current state, basically, we hired lots of officers in the early 90s. There were lots of federal programs to hire police officers, and that's roughly 28 to 30 years ago. So a lot of those officers are coming up on retirement. Our numbers, therefore, have been relatively flat in terms of our efforts to hire and recruit additional officers as we've gone forward. We just have relatively a flat number year by year. The number that we recruit, we end up losing some to retirement or officers decide to go other places. We've done certain things like a lateral officer program that has helped supplement some of our hiring, which has been very good because we're getting officers who already have training and experience that come into our ranks, and then we help them kind of learn the CMPD way. how we do our processes and our policies and things. So when we talk about that, that's kind of our current state. And with the citizen input that we've been getting, the additional recognition of our mental health calls that we have and our current staffing and workload, that's kind of what we're going to do here today, is just look at those things and how we can rethink our response to some of those calls for service.
And the PowerPoint is up, Chief.
Thank you very much. So I think I've covered that slide. If we can move to the next one. So currently, if a citizen calls 911, they expect a police response. So those calls come into our 911 center, and the dispatcher determines how many officers is needed. That's usually an automated thing through our computer-aided dispatch system. So a priority 1 there in red would mean it's sort of an emergency, something's going on in progress, and we'll send the appropriate resources on an emergency basis. And then we go down the line to the least time-sensitive calls. Priority 5s, those are things that a suspect's not on scene. A citizen may be requesting a report. So if you will, if you have an apartment complex where maybe there was a car break-in sometime overnight, a citizen may call 911 and expect to see a police officer to file the report, although there's no real threat of a suspect being on scene. So those are the types of calls that we're kind of looking at to defer to some other alternate response, that in mental health. Next slide, please. So some of the things that we've considered, and these are nothing particularly groundbreaking, but something that we've been considering certainly is the first one there, the 911 call. When you call, who answers that? So we would have a telecommunicator take the 911 call, but we're thinking of putting a mental health clinician in the 911 call center to basically be the first point of help for someone who may be in a mental health crisis state. The second option there is issuing officers iPads. The iPads would be linked to counselors, psychiatrists, or other mental health professionals that if an officer goes to a scene, they could have the ability to connect that patient, that potential patient, with some type of help in the field without potentially transporting them to a medical facility. That would certainly potentially save lots of time in the system, save money from our hospitals, and also possible medic transports. And then the third one is priority 5, looking at those calls that we have and creating a new unit of what we would call tentatively community response technicians. Those would be people other than police officers who could answer those low-level calls where the public expects a response but doesn't necessarily expect a police officer to come handle it. And we'll go through those on the next 3 slides. So the Model 1, again, as I explained, somebody calls 911. There's a clinician in the 911 call center. Thinking through this, if we have say a suspect who's got a hostage or something, we will send a SWAT negotiator to the 911 call center to communicate with that person. So it's kind of that concept where we would have somebody who has resources at their fingertips that they can either counsel, refer, find help for some person in crisis, instead of having either the police come or medic or fire. And potentially that would be saving. Certainly, just imagine a fire response. You have a big truck that would have to go with at least four firemen, and the gas that takes and everything. You could possibly mitigate that type of response, and it would be a more efficient way potentially to do business. Next slide. The second one we talked about was having virtual counseling. Officers could have iPads in the field, connect people in crisis with clinicians, psychiatrists, or other mental health professionals without kind of mitigating the emergency at the time. Take people from the crisis mode, de-escalate, and maybe alleviate emergency room visits or other things like that. Next slide. I know it's probably small on your screen. Those are the types of priority 5 calls that we have. And if we could mitigate some of those responses from police officers, that would certainly help alleviate some of our demand from our calls for service officers and free them up to do the other types of calls or more proactive work to look at whatever crime trends that we're seeing. So by looking at those priority fives, if you had community response technicians or civilians who would respond to those priority 5 calls, you could save lots of time for the officers. You could also potentially do that. It would be more effective financially to hire folks that wouldn't cost as much as a police officer, and to cover the calls, which the majority of those calls occur on first shift between 7 a.m. and 3 p.m. or 3 to 11 p.m. On second shift. And you can see there 45% and 39%. So the majority are first and second shifts. And if we had that, we would have, I believe, a total of 59 hires that we would have to do to fill that. And that would reduce the number of police officers that we're currently short, if you can imagine that going forward. So with the reduction of those calls, it would reduce the need of our officers, reduce it by 59, and potentially, again, save money in the long term. So our next steps, certainly the first 2 options can be done. We've begun looking at those actually before this whole process started, because it's some of those ideas, again, that we've been seeing in other cities. Harris County and Houston, Texas is one of them. So we would evaluate a program like that, see if we can do it. I think we could do it through partnerships with possibly the county, the hospitals, and our current contract with Crisis, which provides the clinicians for our CPCRT team. And then we'd have to, on Model 3, it would take a little bit longer because we would talk about hiring, the background investigations and things that it takes, plus the budget to hire 59 non-sworn employees or officer equivalents. So if we decided to go that way, that route, it would take a little bit more work, clearly, than Models 1 and 2. But those are the things that we're considering, and so we appreciate any input you have. And if you have any questions, I'm certainly here for it. Well, the budget salary comparison, certainly you can see there on the screen, we have, it would be cheaper to hire a clinician versus a police officer.
So, Chief, is there any benefit to the officers in terms of just being out in the community and having face time with members of the community that would be lost if we moved these activities over to other people?
Yeah, I think you would. It's an expectation of the community, and I think that's what we would lose there. You'd have the interaction where the public expects certain things of the police, and when you call 911 and you want a police officer to make a report for you, you feel like you're getting that service if they show up. If somebody besides the police shows up, there might be some expectations that weren't being met there. But that's kind of one of those things that we'd have to probably do some community surveys. For example, we constantly have, again, larceny from auto as an example. You may have a large parking lot with a large number of cars that are broken into, and the getting physical evidence from those cars is many times not effective. But the public expects you to come to us for fingerprints, or they expect the police to really take their crime seriously, and that's part of our customer service. So we've considered not responding to certain calls in the past, but for the most part, we've not done that. We've always tried to be customer service focused. The only time I can really think of where it's kind of an exception to that is noise calls, say on the 4th of July, where we get inundated with fireworks calls, gunshots, things that are just overwhelming, especially around midnight. And so our sergeants a lot of times zone check or be on the lookout for instead of a police response for those types of calls.
Thank you. Mayor Pro Tem?
Thank you, and thanks, Chief. So I have a couple of questions on this. When you had listed sort of a breakdown of the priority 5 calls, but I wondered if we could at some point get a breakdown of all calls for service, maybe over, because I know that's a huge volume, but maybe over a 3 or 6 month period. And I'd be really interested to know how that breaks down between priorities 1 through 5. And then the second question is, those priorities seem to just relate to crimes. So what about calls for car accidents that officers have to respond to and help fill out information for insurance, as well as the neighbors having a party, they need to turn their volume down, or the uptown bar won't turn their volume down, and we call the police. So I just, I wonder if we're capturing all of those calls that could possibly be going to some kind of an outside organization. And I'm a big proponent of that. Albuquerque has just launched that as well. And they have done a good job, as has Newark, in really assigning a value to that time spent doing some of these things like responding to a car accident and what it can save the department, and that's what then informs the money spent on a separate organization. So I wondered if you could speak to that, breaking down all 911 calls and what could potentially be transferred to another department, another organization that would not have, that would employ people that don't have the training to respond to violent crime that the police department does.
Certainly. So to your first question, those calls you referenced, accidents without injury and without any type of dispute, like a hit and run, like a crime, we have those cataloged in the priority 5s. Noise complaints, I believe, are also on there. Homeless calls and things of that nature that wouldn't necessarily require a police response. And also to the question of, can we break down all of the calls for service by priority? That shouldn't be a problem, and we can turn that around to your committee very, very soon, probably in a day.
So-
Probably in a day or so.
Oh, that'd be great. Would there be a reason that some of the priority 4 calls could not also go into some sort of a separate organization if you had staff trained to do that work, or mental health counselors, that kind of thing? Could we not carve out more 3, 4, and 5 priority calls?
We can look at priority 4s are mainly the crime scene calls, which are non-sworn employees who go to follow up on a burglary to process evidence and things. We'll have to go through the priority 3s and see if there's anything appropriate there that we could potentially have a different response besides a police officer.
Okay.
Those are more where a suspect may be on scene. A priority 1 would be where a suspect is on scene or is actively participating in the crime. A lot of those calls come in literally in progress.
Okay, thank you. Yes, I would like to, Mr. Chair, be able to get that information on
Can you get that to us?
all calls.
Yeah, and Mayor Pro Tem, I apologize. At the beginning, I did not go over the Q&A packet that we gave you yesterday. It does have all calls over a 7-month period. However, what it doesn't have, to your point, is it doesn't have the priority level of each call. So Chief, I guess that would be the piece that we would need to add to the all call data that we have in the packet that was provided by you guys.
Yes, sir. We'll update that.
This adds up to 20,000. Oh, the 211 here, that's a 7-month period? Because they were running 700,000 a year, aren't we?
Yeah, that's only like 6.5 months.
Okay, and that's also citizen calls and not all calls.
That's 911 calls.
Right, yeah. I have, you all set?
Thank you.
Councilmember Johnson. Renee, are you there?
Sorry about that. Thank you, Chief. Can you please remind council and the public what CPCRT stands for? Please.
Community Policing Crisis Response Team.
Okay.
It's the concept of a sworn police officer who's CIT trained with a mental health clinician, and they ride together and respond to those types of calls, or when officers refer because they have a mental health episode or some type of incident where that could be helpful.
Okay. And then my next question is, for the priority 5 calls, if we're looking at a community response team, would that be a mixture of mental health professionals and officers or individuals that can respond to traffic calls and non-clinical or non mental health related? Are we looking at a mixture?
No, I think that the CPCRT component would be for mental health calls, homeless calls, things like that. Whereas the option 3 that we showed in the PowerPoint would be more a non-sworn component of a response in lieu of a police officer. But the recs and things like that would not need to have a particular mental health focus.
So let me clarify. If I'm talking about the proposed Model 3, the community response team, would that consist of mental health and non-mental health professionals who could respond to traffic calls and noise violations and everything?
Sure. No, the community response, I think, would just take that, just call them technicians, if you will. They are not going to have a mental health focus. They would handle wrecks or alarm calls or anything that wouldn't require a sworn police officer. And then our CPCRT would remain intact and possibly be expanded in options 1 and 2 to handle those types of calls.
Okay, so we'd hire, I think the number was 59 individuals to handle the non-emergency calls, and then we would enhance the CPCRT?
Yes.
So that.
Yeah, yes, ma'am. So if we decided to include the option 1 and 2, that would have to be an enhancement of our current contract if we go with the same provider, or we would look to outsource that to the hospitals or another type of behavioral health place that we could enhance our mental health response.
Okay, so I'm sorry, and just so I'm clear, if you know that there's a mental health crisis today, we send out the CPCRT team that has a sworn officer along with the mental health provider.
That is correct.
So is there an option, and I guess that would be to enhance the crisis mobile team or enhance the hospital system some type of way, where only a mental health provider could go to those calls that aren't considered dangerous? What option does that look like? What would that look like as far as these options?
Okay, I'm going to turn it over to Captain Jackson to talk about that.
Okay.
Zoom it out.
You got it. You can talk, Ryan.
You can talk.
Yeah, so I think to answer your question, I think it would start applying to option, you'd kind of combine option 1 with option 3, right? So the mental health triage that they would end up performing would be this licensed clinician would be able to de-escalate it before an officer ever arrives out there, or maybe even cancels the officers or the fire truck before they even get dispatched. So they'd be able to solve the problem before anybody ever makes a response. Like they would hold it into a different queue where nobody would end up responding unless certain phrases are mentioned or certain aspects of that call requires a police response. And then the officer would be en route to that scene. However, they may get canceled from that call before arriving because the clinician was able to divert the call. So where a clinician would go out all by themselves, I don't know where that would end up falling, right? So if the city's going to hire that clinician, right, where is that going to even fall underneath the police department for that type of call for service? So if that's the route, not many other agencies are using that method. Houston PD, Harris County, that the chief mentioned, they have, obviously they're the 3rd largest city in the country, and they have a model where they've partnered great with the county because a lot of their clinicians that ride with officers, their call diversion, their homeless outreach team, everything is falling underneath the police department and the county health. So the county health, they're pretty streamlined. Like when we were telling them that a mental health call with a patient, there's times that Billingsley is on diversion. The first hospital we try to go to is on diversion where they won't even take the mental health patient. And they were kind of dumbfounded by it because they have their own county facility and everybody gets accepted when a police officer walks that client up there, that consumer. Right, so there's a lot of different aspects that needs these are kind of almost like Band-Aids on the system versus getting a true big fix that's gonna cost, the city, county some funding to figure it out and get it right.
Okay, and just to give you a little background, Councilmember Azmir and I are both on the safety team as well. And a few hours ago, we were in a meeting with a presentation from the community engagement team. And that was a recommendation that we enhance programs such as the crisis intervention team or mental health professionals going out and triaging those calls, because there was also discussion that I think up to 17% of folks incarcerated locally have some history of mental health, and we know statewide or nationally the numbers are much greater. So that's where I was connecting those dots, but so that's why I asked that question. So I think, Mr. Chair, there might also be an option for council, as we're considering all of this, to even enhance this even further and combine kind of the model 1 and 3, and maybe there'd be a model 4. So thank you, Chief and team, because what this shows is that it's an all hands on deck approach, and we're all thinking the same way, how to improve community response. So thank you.
Yes, thank you. And I think this committee was focused on trying to quantify what resources we might be able to divert from, on a basis of having, say, the priority 5 calls responded to by others, and we see an indication here of roughly $3.5 million. I think the policy question of whether we want to invest more might be a safe communities or full council kind of conversation. I did want to say, Mayor Pro Tem, you and I have spoken about other cities and some of the things that they have done to modify their delivery of police services or to create separate entities. Is there anything that you've learned about that that might be relevant to the conversation we're having?
Thank you, Mr. Chair. I think one of the things that we have to keep in mind is our form of local government. So speaking to what Ms. Johnson's talking about, we would have to have the buy-in, we'd have to be working with the county to be able to enhance those services. And I think everybody agrees that that is just one of those universal truths, that we just don't have enough mental health services in our city or in most cities in this country. But when I hear other cities talk about what they're doing, they are our peer cities, but they have, a lot of them have health and human services also under their umbrella. And it makes it a lot easier to make decisions like that. Whereas, we really have to be intentional, and we have started that by having the conversation about treating crime as a public health crisis, violence as a public health crisis. And so I think that's really the best way to do it, is to take the group that Gibby Harris has started and have these conversations and get to a place where we can agree that we have to invest more in our mental health resources in this community in order for whatever model we do with the police department to be successful. Because at the end of the day, it's kind of like teachers, right? If we don't have those resources, we expect the police or we expect teachers to pick up the slack and cover it. And that's really a lot of what this conversation needs to be about.
And Mayor Pro Tem, you know that in recent years there have been budget cuts in some of these areas by the county. Mm-hmm. And so the police have been in a position of taking on more and more of this stuff, not necessarily on their own initiative,
right,
because of a default, like you say. So, there's a presumption that they will make up for that. So in effect, we might be just trying to reverse that trend.
And at the state and federal level too, if you really talk about the court system.
Right. Councilmember Graham, are you with us?
And following along very closely to the conversation, and I think it's really important that, I know the manager as well as the mayor have been meeting with the county manager and the chairman of the board. I think it's really important that as we move forward, we really have to pitch that conversation further in terms of the city-county collaboration along the lines of public safety and public health, it just won't work alone. And so I'm really optimistic that we really can find a way sooner than later to really have those conversations a lot more public, because I think it's really, really needed. For an example, the cure of violence that we're doing the assessment on, I think we don't need an assessment to tell us that we need as a part of that, wraparound services, not only the crime prevention, but also where do we run people to, whether it's run them to substance abuse help, mental health, um, more affordable housing, jobs, workforce development. So it's just not one thing. And most of those items are across jurisdictional line with the county, which makes the case for consolidation, but that's a whole nother meeting.
So, and I asked you specifically, Councilmember Graham, because I know about your focus on safety on Beatties Ford Road and your call to the police to do more effectively. So if we had this type of redeployment of assets as being discussed here, you think that's consistent with your goals for a safe community on Beatties Ford Road?
I think it's very consistent, because a lot of the calls for service over there are certainly crime related, i.e. Catherine Simmons is an area where there, I believe, needs strong law enforcement. But there's so many other situations up and down that corridor that requires a different response, and a law enforcement response, like I said earlier in reference to some of the items that I would consider wraparound service, mental health, housing, substance abuse, etc. And it deserves a different type of response where we can free up the police department to really be more effective and efficient in terms of delivering on their mission statement.
Great, thank you. So I think generally where we're headed is some combination of 1, 2, and particularly 3. And I think the takeaway for this committee will be, for one, to refer to the manager for the benefit of the full council some of the data we received, some of the manpower data, and those explanations so that everybody on council can understand that. And
Mr.
couple of the
Chairman?
items I just reprised. Did I hear a voice?
Yes.
Yeah, go ahead.
My hand has been up for a while. So I wanted to just quickly go over some of the data that we had received in the package, where we have our response time is around 6 minutes and few seconds. And our goal has been 7 minutes. At least that's what we have stated in the package. Are we comfortable with that? I just wanted to hear from our committee members as to how do we feel about the current goal, and what does that number look like across other cities? And if we were to reallocate some of this services to mental health counselor or other providers, are we looking at changing the response time from 6 minutes to maybe 5 minutes or more? So I just want us to be mindful of, at the end of the day, to Mr. Graham's point, are we really focusing on our mission for CMPD by reducing the time we respond to some of these calls that we get where we have to have police officers there?
Chief Voorhees, I don't know whether you can provide any comment on what the specific significance of 7 minutes is and what the implications would be of changing that to 6 minutes or 5 minutes.
Certainly. I'm going to refer to Monica Wynn on that one.
Thank you, Chief.
Yeah. So our performance expectation of 7 minutes to a priority 1 call, so that's your violent crimes, your personal injury, accidents, and those types of calls. When we have reported that we make it to those in, let's say, less than 7 minutes, that is on average. So average just means that more than 50% of the time, we're making it under 7 minutes. But there are still plenty of times, because of our staffing shortages, because of those 500 officers that we're short between our vacancy rate and what our workload and staffing analysis results show us, is we would need those officers in order to be able to just meet the 7-minute response time to our high-level priority 1 calls all the time. Just to make sure that there's no misunderstanding, there are plenty of times, especially in our larger divisions, where you have to travel a lot further, and depending on the different staffing levels and circumstances, that we're not meeting that 7-minute response time. So it would, if we do reduce that performance expectation in our patrol staffing model and say we want to get there within 6 minutes, it's probably going to have an astronomical outcome in terms of the number of officers that our formula will say that we need to be able to accomplish something like that. I think in most cases, when I've spoken to other people that have worked with other large jurisdictions, 7 minutes is a pretty reasonable time. And everybody says that when they try to reduce it below 7 minutes, that it's almost a goal that you can't attain, because you need so many patrol officers to be able to accomplish that.
And they would actually not even be that active, because you would have to have a dense network of officers available to respond, geographically dense network of officers available to respond to calls, and they might be standing by a lot of the time. So I think that there's an efficiency question as well. I wonder if it's going to be possible, using our data and the data dashboard that we have, to draw any conclusions about the correlation between response times and outcomes, where we could show that if we had shorter response times, we could expect fewer casualties or more arrests or something like that. But I have a feeling that's kind of open-ended. It is probably going to be a topic for further research, because we're trying to wrap up today some recommendations that we could make in the current process. So certainly worth thinking about, but that's bigger than it looks, trying to tackle that.
So, Mr. Driggs, to follow up on that, I guess if we can look at some sort of projections, that let's say if we were to have more mental health counselors, or to meet the needs that's out there, what kind of response rate are we looking at? Maybe less, some sort of projections that would help. So it's not just in terms of the cost reduction, but also being effective in the work CMPD does and efficient, where we are probably responding. And I heard that 6 minutes, some seconds was an average time. What is the median time, median number? That's what I would be interested in. But I do agree with what Councilmember Johnson and Mayor Pro Tem had alluded to earlier about having some of these responsibilities to other resources, and also collaborating with our county so that we can really address the needs out there. We have heard over and over again where we really need more mental health counselors, which will free up some critical time we need from our police officers on solving crimes. Thank you.
Thank you. Mr. Bergman, do you have more?
For this?
Just generally, we're working through our agenda here, and I think we've covered most of what the police budget review was supposed to address. So should we talk now about committee considerations of initial recommendations?
Sure. So for those of you who weren't on the meeting earlier, the Safe Communities meeting, we're trying to put recommendations or at least concepts from a number of different committees into a document, into a format that you guys can discuss next Monday afternoon, and I believe that there's 4 hours for the discussion. So that's really expected to be the come-together piece of all of this work that has been done. You guys have been very active across multiple committees. But from this group, I think what we would need to know is generally, what are your expectations that is reported from this group? I don't know if that's in the format of a motion, a recommendation, just kind of general agreement. I'm hearing that we have these options which are actually mutually exclusive. It's not 1, 2, or 3. There's 3 things that you could do all of them. But I'm also hearing some discussion, like from the Mayor Pro Tem, about some of the other models where it's just a mental health responder, such as Eugene, Oregon, and Albuquerque and Denver. And then I'm also hearing how do we increase some of the collaboration with the county on some of these issues who, as you all know, have mental health. So on this specific one, that's what I'm thinking, but putting it together, I think, would be what we would spend a little bit of time on now.
Can I just clarify? I'm not, I was not advocating for just mental health response. It's more creating a separate organization that responds to mental health, that has the trained personnel that are non-sworn officers, but also to the other types of incidents that don't require a SWAT team to come or an armed trained officer. So nonviolent incidents as well.
So would you envision that to be a new organization, or is it a question of just assigning Wright County and other departments to be the ones to whom those 9/11 calls are directed?
So Albuquerque does it in a separate department. And so if you call in, you're either going to get fire, medic, police, or I think they call it civilian response. And so that model, for us, we would really have to form it with the county, I would think.
That's it.
Yeah, and so that would take a little bit of work to put that together, what that would look like, and of course, we'd have to have our colleagues on the county commission weigh in on that and have buy-in on it. So I don't know exactly what that model would look like, but in essence, it's what you were saying, Mr. Chair, that it frees up our police officers to patrol the streets, to patrol neighborhoods, like a lot of neighborhoods are asking for. They want more police presence in their neighborhoods to really attack the problems that are denigrating the quality of life in a neighborhood. And that's primarily what police officers generally are trained to do, and not to respond to some of these things that we've put on them. So it would be a separate department.
So, I wonder, Mr. Bergman, if this committee requested that you pull together a kind of summary of key findings from our work, and that would start with those initial buckets, but just very high level, the manpower calculations and the status of our manpower, getting into the purchases that are made, the details of the purchases, for the benefit of the full council and for the continuing process. And then I think our finding is that resources could be, that there are currently activities in CMPD and funding related to those activities that could be moved to out of CMPD, and that possibly that would involve creating a new entity or cooperation with the county to create a civilian response capability. And broadly speaking, that's about as far as we get right now, I think, right? And we can point to $3.5 million that are associated with the Category 5 responses, although not necessarily limiting ourselves to that on further examination. Is the committee okay with a conclusion kind of like that at this point? And could you have that for us to just circulate before we go into October 5th, so that members of the committee might be able to provide some feedback?
Mr. Chair,
Yes.
I'm sorry, I had my hand up for a while also. I wanted to get some clarification on the model number 2. If we could go back, I just wanted to understand, are we saying that the police officers would go an iPad and connect with a mental health counselor via some type of virtual visit?
Option.
Is the chief still on the line?
Yeah, yes, ma'am, I'm sorry.
Okay,
I think you're talking about option 2.
yes.
Yes, ma'am. Your question related to that? I'm sorry, I missed that.
So option 2, my understanding, and correct me if I'm wrong, is that a police officer, if it were a mental health distress call, is they would have a mental health professional on the other end of an iPad for some virtual visit type of option. Is that what I understood?
Yes, and what we would hope to do there would be to, if you didn't have a CPCRT clinician available to respond to that call, that you could have something as a stopgap, maybe have an iPad so that they could contact a clinician and have a session, if you will, right there to perhaps either de-escalate or mitigate the need for a response to either a medical facility or any further treatment or something like that. I think it would be an efficiency thing that some people call the police because they're lonely. There's a lot of different reasons, and this would be something where you provide a service without having to go beyond maybe just meet their needs at the moment.
So the officer would be present while the constituent or the resident is talking on the iPad to a counselor?
No, that wouldn't be the goal. The goal would be to produce the iPad so that that person could have a session, whether that be in a car alone or whatever. It wouldn't be the idea. Or even if we had that option 3, perhaps they could have an iPad too and go to those types of calls and connect the two parties.
But even for option 2, the idea would be for the officer to carry the iPad and then give it to the resident and still be there while they're using their iPad?
Correct. Like a CIT officer would go now, and instead of them trying to provide the service, connect them with a mental health professional to get the services they need for referrals or anything else to help them really meet them where they are and provide what they need at that moment.
And see, my thought is that funding would be better utilized to actually have a person there, because what we have then is an officer. We're paying a sworn officer who's just a bystander while the individual's getting the services. So I don't see option 2, just the way I understand it, as practical, because it is still taking an officer off the street for emergency calls while they're not even able to serve the resident. So I was the one that said I support the mental health professional going out to the call, because while that's not what we hire our officers to do, so many times it's what they're doing, and it's who they're interacting with, individuals with mental health and addiction. So we really need to meet our community where we are. So I like the idea of number 1 and having mental health professionals kind of triage the call. Maybe when you call 911, you need fire, health, emergency, or mental health. And then we actually, if we're looking at hiring 59 individuals for a community response team, maybe 20 of those be mental health professional, or 29, and then 30 be for traffic. So I think it's worth the investment to really focus on the mental health and addiction. And that's just my thought as a committee member.
I think that's a fair comment. I don't think this particular suggestion with the iPads has big implications as far as resource allocation is concerned. I mean, correct me if I'm wrong, Chief, but I think this might be a means of improving service delivery under certain circumstances where the medical professional is not immediately available. But the focus here is probably on 1 and 3, frankly.
Yes, sir. I think option 2 is it's sort of a stopgap. We don't have enough CPCRT clinicians currently to meet the needs that we have. We have our patrol officers asking for CPCRT resources a lot, and they're available when they're available, but they don't work 24/7 because we don't have enough. So this is a kind of a way to be a stopgap in between having to take someone to a mental health facility, which takes a lot of time and effort, when maybe they only need just to talk to somebody, briefly to get services. So that's kind of the idea behind it, but certainly it's just an option.
So I think to Ms. Johnson's point, our first line is to get more of those clinicians and continue to regard the iPads, if at all, as as you suggest, as kind of a stopgap or a better than nothing type of thing, but not in lieu of. So, Mr. Graham, the outline I just suggested to Mr. Bergman, would you have anything to add to that?
I think that's pretty comprehensive and complete. I can go along with that.
All right. So at that point, if we're all in agreement, then what we'll look forward to is hearing just a recap from you of what the committee has done and some recommendations we're making to the full council, and we'll have a chance to take a look at that and make sure that we're all in agreement, but I think there is a consensus here. Is there any comment from anybody online still? And is there any other business, Mr. Bergman? So, without exception, I'm prepared to entertain a motion to adjourn.
I make a motion to adjourn.
Do I have a second?
Second.
Okay, everybody in favor, get up and leave the call. Thank you, everyone. That's unanimous.